With more than 100 million Americans affected by diabetes or prediabetes, it's a growing epidemic in the U.S.
Here with tips on avoiding and controlling your diabetes is board-certified family physician and Nutrisystem ambassador, Dr. Andy Baldwin. Welcome to Arise.
Hi, how's it going?
Good, thank
Great.
you.
Good to have you.
Great to be here.
So you have to help us out. Can you explain to people exactly what diabetes is?
Sure. Well, it's really important that people know and are aware of diabetes. It's Diabetes Awareness Month in November. That's why I'm out here in New York. I ran the marathon the other day with the American Diabetes Association team, Team Nutrisystem. But really, 30 million Americans have diabetes. But what's even more scary is that close to 90 million Americans are walking around and either have diabetes or are very close to getting it. And so they need to be aware. People, if you're watching right now, you need to know that the majority of Americans, especially with the obesity epidemic creeping up, you should get tested and find out if you're at risk.
30 million?
30 million.
And
those are the people that have actually been diagnosed, but 3 times that are close to or may actually have it already.
How do you explain that astounding number? What's going on in the culture at large that is making us prone to diabetes?
Well, diabetes is all about blood sugar and your body's inability to absorb it correctly and utilize it through insulin. Your insulin receptors become resistant to doing that properly. So you get increasingly tired. You start to have to go to the bathroom a lot more. It affects your nerves, your heart, your kidneys, everything. And a lot of it is tied to genetics, but it's also tied to increased sugars in our diet.
Okay.
So it's Halloween. People got to go easy on that Halloween candy.
Now, is it true that sugar can be more addictive than cocaine and heroin? I've heard some statistics.
Absolutely.
I mean,
people, look at chocolate, you look at sugar, you just look at the soda culture that we live in, and it's all about that dopamine center that's involved in everything that's addictive, and it ties back to that. So that's why what you eat is so crucial. I mentioned the numbers of people that have diabetes or are close to getting it, and the key is it's preventable. It's not like you have a disease like cancer or something that is that's there to stay. You can prevent it. So that's why I'm trying to raise awareness. Well, it's all about activity and diet. And so
we've got to move and we've got to change our diet.
Exactly.
What should we be doing movement-wise, and what should we or should we not be eating?
Well, Americans are increasingly sedentary. We sit around. So standing up throughout the day while you're working, getting out just for 15 minutes to walk the dog or to throw the frisbee with a friend, whatever it may be, but increasingly walking, and then controlling what you're putting into your body nutritionally. I do a lot of work with Nutrisystem because I believe in their product. Nutrisystem has a scheduled meal plan called Nutrisystem D that diabetics can count on to not raise their blood sugar. When I have patients come in that are newly diagnosed, that's one of the things I point to that they can count on and trust. So,
what's typically in that meal plan?
It's a balanced diet, and you have a lot of the foods that you typically would eat. It's whether it be macaroni and cheese or chicken. And yeah, it's really good. I actually eat it myself. I'm not diabetic, but that's how much I enjoy it.
Well, once someone is diagnosed, then what can they do at that point, especially to control diabetes? Well,
that's the key. Is all it is a simple blood test. So if you're watching this right now, go out and ask yourself, am I at risk for diabetes? Do I have a family member that has diabetes? Have I gained weight recently? Do I eat a lot of sugar? You go to your doctor, you get a blood test, and it can indicate whether you're pre-diabetic or diabetic. And once you find out, the first thing to do is changing that lifestyle, really making a commitment to it, because really what's going to take your life early or lead to heart problems, kidney problems, eye problems, that's by the time that happens, it's too late. And really, when I have a successful story of somebody that's on Nutrisystem, or I get out into the gym or out walking around and I see them lose that weight and they don't have to be on medication anymore, it really makes me smile.
Now, there is a misconception that only overweight people suffer from diabetes. That couldn't be further from the truth.
Well, being overweight is one of the biggest risk factors for diabetes, just because you increase the amount of tissue and the demand that's put on the insulin receptors, but it's not necessarily required to have diabetes. A lot of it can be genetic, and so that can be a misnomer. one of the success stories, one of the guys who ran the marathon with me on Sunday is Jason Badal, and he lost almost 250 pounds and finished the marathon alongside me on Sunday. And he was an incredible risk due to the diabetes that is developing and obesity, and through Nutrisystem, he was able to lose that weight over a gradual amount of time, over 2.5 years, and he's kept it off for 2.5 years now as well. And so if he can do it, and I know there's people out there just like that, if he can do it, and I see how happy he is at the finish line, it's just about getting up and making those everyday changes. And you'll have a healthier, happier life.
Yeah. Now you mentioned the New York City Marathon, but you've actually run 50 marathons, triathlons, and Ironman competitions. Why are you torturing yourself? And do you plan on continuing doing so many?
Well, I mean, it's something I've done all my life. It's something that is part of my lifestyle to be active. You don't necessarily need to go out and do an Ironman or a marathon. It's all about getting out there and just being active at whatever's right for you. But it just starts with that. Now I'm a bit of an extremist, and I like to see how far I can push my body and mentally. But I like to do it for a good cause as well. So really being out there, with 50,000 people on Sunday and running in the greatest city on earth. It was my 6th year in a row doing New York City Marathon. It was about being in that active culture, walking the walk. And I think as a physician, nothing points more to walking the walk than that. You don't want to go in if you have an overweight or non-active physician.
Yeah.
So being active and then structured, balanced meal plan, that's the key. But really, get out there and get tested. That way you know if you're really at risk.
All right, great advice. Thank you
Thank
so
you.
much,
Thank you.
Doctor, for stopping by.
Thank you.
Thank you.
All right.
And you're watching Arise Entertainment 360.